A major hospital network in Ontario is considering allowing unvaccinated nurses to return to work on the front lines as severe staffing shortages have led to critical overcapacity. The South Bruce Grey Health Centre, which operates 4 hospitals, says that the severe human resources challenges it's facing has resulted in closures at all 4 of its emergency departments at various times. So joining us this morning is Ivy Bourgeot from the University of Ottawa, who leads the Canadian Health Workforce Network. Great to have you on the show.
Thank you.
Can we start with unvaccinated, or what is referred to sometimes as under-vaccinated workers? Though there is no provincial requirement for healthcare workers to be vaccinated against COVID-19, there are a lot of health networks that make that requirement. However, a provincial requirement it is in Nova Scotia and British Columbia. The majority of provinces who at one point required healthcare workers to be vaccinated against COVID have since reversed course. Should all jurisdictions consider reversing course, requiring workers to reconsider this policy on fully vaccinated staff?
Yeah, so thank you for asking about that. I think it's an important issue that a number of hospital directors and health service directors are grappling with. I think because of the crisis situation that we're in, many people are grasping at straws in order to keep their hospitals open. The broader issue, really, though, is the retention of workers. Why are workers leaving? Why is it that hospital directors and health service directors are feeling that they have to bring people in, workers in who are not vaccinated? That's really the bigger issue at play here.
We know through firsthand stories, nurses are feeling this intense pressure to provide care in a broken system. Here's some numbers to give us a clearer picture of what's going on. StatsCan found that 92% of nurses felt being more stressed at work prior to the pandemic. 45% of all healthcare workers said their mental health had declined compared to its pre-pandemic state. So how do we improve the environment for our healthcare workers to avoid them leaving the sector?
Absolutely. Well, this is the downward spiral that we talk about, right? There are very, very high levels of workload. That is leading to very high levels of burnout. And then you are seeing this in the measures that you just highlighted in terms of attrition. And attrition could be whole people, like whole nurses, health workers leaving the system, but it could also be, deciding to go from full-time to part-time because they can only take on so much. You have physicians who choose to work less hours as a way to cope with their mental health issues, but also the increasing workload. So you see of that as a spiral. As you have more people leaving the system, you have higher workloads, you have more burnout, and it's just going down that way. Now, it's important to note that this existed prior to the pandemic. The pandemic exacerbated issues that were already there and were not getting any attention. What also exacerbates that issue around attrition and the workload are issues of poor pay, feeling that you are not recognized for the work that you do, not being given particular rights that you have in terms of collective bargaining. And then it has to be mentioned the very high levels of violence that are experienced by health workers, which, depends on sector. And as the wait times increase and the population and patients, those coming to health services, have longer and longer to wait, and, they are impatient about that. The first person that they see are health workers. And so those frustrations get taken out on health workers. Again, that predated the pandemic, but has been exacerbated by the increase in wait times. So we have a really vicious situation here that we have to turn around. We have to interrupt it. And there are proven solutions that can do that.
Ivy Bourgeot, I want to thank you for coming on for this conversation. More to be said at another time. Thanks so much.
Thank you.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.